Welcome back. Tonight, we are assessing the impact of COVID-19 when it comes to the frontline health workers who are doctors and nurses who are battling this particular pandemic, looking into whether the government is supporting them enough, given that you have started reporting cases, one case of a doctor who succumbed to COVID-19 and 2 nurses who have succumbed to that particular virus, and more than 200 doctors medics who have been infected with the virus. We are having Alex Mudhui from Kelly Organization, a non-governmental organization that advocates for health and human rights. Welcome, Alex.
Thank you, Erin. Thank you again to have me on board, and we really appreciate for your time.
All right, so let us start from what we, given that it is almost more than 100 days, it is actually more than 100 days since, we started battling with this particular pandemic, and assessing what we are seeing so far. Are we seeing enough support to the healthcare workers as they battle this particular pandemic?
What I will say from a human rights perspective, because that's our main field, and also championing for the health rights for all, according to our constitution, mostly pertaining Article 43(1) of our constitution that entitles everyone to have the best affordable health in the country. So based on that, that also includes our healthcare workers, because they're part and parcel of the citizen that the government has to take care of. And concerning if the healthcare workers are getting enough support, I think following from the media and also following from the unions, what they have been saying over the last period of weeks, is that the numbers are increasing exponentially, and this one, if I can just relate it to our previous routine monitoring that we did with our healthcare workers, I think we foresaw this, and because of the trends that were forthcoming, and it requires actually the healthcare workforce to be well equipped towards occupational safety and health. We've seen the government has put measures in terms of trying to equip the county facilities. They have given those directives, and the funds have also been provided towards that. But what is coming out is that the healthcare workers, in terms of the numbers that can support the flow, the patient flow, especially the COVID-19 patient flow, is wanting. Still don't have that number. So in terms of the PPEs, I believe there have been numerous support from the foundations, including the COVID-19 response management team in the country, which is also spearheaded by Equity Foundation. We've seen them distributing PPE materials. But now when it comes to the healthcare workforce, I think in terms of the capacity, this is something that they have been crying out. And even we saw today, KMPDU chairman, a very good friend, Dr. Machonda, also acclaiming to that.
In terms of capacity, we have seen Mwachoda, who is from the KMPDU, claiming that they do not understand why the government is employing doctors from Cuba, given that we have not even supported our own and even increased the capacity of health workers using the doctors who are here, who are unemployed. Do you really read from the same script? Is the decision that the Ministry of Health made a bad one at this particular time?
I will not want to dwell so much on that, but what I can give my views on that is that I think the Cuban doctors were brought in Kenya to serve a certain purpose, which was to strengthen our healthcare system. That includes now the transferring the capacities to our medics and our healthcare system. So, and that was specifically towards certain elements where maybe we felt they had some certain strengths, which maybe our capacity could not be able to handle. So it was a sort of a health system strengthening program. Now, talking of that, and in regards to what maybe Dr. Machonda had mentioned earlier, is I'm not sure if they foresaw that there'll be other health pandemics that will be coming. Most of us, we don't know about the agreement between the Cuban doctor because it was government-to-government contracts. So I think based on the details of their contracts, then maybe you can elaborate on that. But based on just to support what Dr. Machonda had mentioned, is true. they still do, we still don't have enough capacity in terms of the medics and also in terms of the trainings that they have been conducted towards health pandemics. That includes now the current novel coronavirus. So I think it's key that these trainings need to be disseminated. More medics, more healthcare workforce needs to be trained and capacity built on how to handle, how to manage, control, and respond towards such pandemics. So that could be my just general overview about both the Cuban doctors and how they've been helping, because also an assessment has not been done to find out if also they've been trained on such pandemics and what they have done so far to support our healthcare system in the counties where they've been deployed. What have they been able to achieve in terms of strengthening the healthcare system, mostly in responding to COVID-19? So I think if that assessment has been done, then I think that will be a very good ground to assess their impact towards our healthcare system, towards if we talk about in this novel coronavirus context.
All right. Now, in looking about the issue of increasing the capacity of health workers to avoid the case of overburdening by ensuring that we have enough doctors in all the medical facilities, given that almost now we're talking about 44 counties that have reported cases of COVID-19. So what should be done? What do you think, what are some of the efforts assessing what is happening right now? Do you think the government has done enough in employing enough doctors? Because we have only had them in press conferences talking about employing 5,000 doctors, but still we're having the unions talking about they do not have enough doctors in most health facilities. In your assessment, what can you say is really the picture?
I think the government has tried to some extent in order to respond, because one of the key issues when this pandemic was starting and when we also did the quick assessment on our preparedness of the healthcare providers all over the country, when we were looking at occupational safety and health of the healthcare workers, one of the key things that came out clearly is that the current healthcare workforce is not well prepared and cannot be able to handle the current inflow of patients. And you can remember this was as early April and also early May. So almost 2 months ago. So we foresaw this and we were looking at the occupational safety and health of the healthcare workforce. And they needed more capacity. They needed more healthcare workers in the facilities because of the influx of numbers that was forthcoming. So talking about that and looking at what the government has been able to do, increasing and also employing more staff, maybe on temporarily contracts, which to some extent also doesn't augur well with the healthcare workers union. So that is one. So the other part is in terms of the numbers. Are these numbers sufficient? Clearly, they are not sufficient because as you've seen also today through the healthcare workers union, specifically Dr. Machonda, what was alluding to is that in the next 2 weeks, the healthcare workforce will be totally overburdened. Why? Because the influx of patients keeps on increasing while the healthcare workforce is constant. So what does it mean? And you see also because of occupational safety and health, there might be some extent of more risk or more exposure for the healthcare workforce. That means some of them might be isolated, might be quarantined because of the exposure. Then it means the number of healthcare workforce might be reducing. So who is going to take care of the patients in the facilities? So that's a big issue. And as I was alluding, based on also recent research papers and case studies that have been done in the region, it's very alarming and sometimes it's very disturbing as being compared with our neighbors that we've not done as expected. One of the papers clearly stated Uganda and Rwanda, they did the right thing at the right time. They did the measures, they took the measures seriously. Though we had partial lockdown, we can say for Kenya, but did it work well? Those are question marks we should be asking ourselves. Did it work as expected? Did the numbers reduce? Did the cases reduce? Have we seen an increase after the reopening? So what does it mean compared to the countries like Rwanda? Rwanda was the first African country to do to conduct total lockdown in the continent. The reason why they say previous health pandemics, this is why they were better prepared in terms of they have experienced Ebola or risk of Ebola. So they were much prepared. The healthcare system, they were much prepared, and they took the right measures on time. So for us, I think as a country, and though the government has done, we should also commend what they've been done, what they've been able to do so far. But what we are saying, they should do better, and they could have done better. So it's a learning curve even for the healthcare system, what they need to put in place going forward, and to ensure that also there's equity, because that's what we're also championing for. There's equity in healthcare approach, because today, if me and you maybe unfortunately are exposed, can we be able to get the right healthcare services compared to any other person in the Republic? So that healthcare equity is very important. So that, and the reason why the thing that needs to be done is to strengthen the healthcare system, that it can accommodate everyone without risking someone's life, and also without risking someone to go into abject poverty. As you can see, the medical care or the affordability for COVID-19 treatment is also quite expensive. So what does it put as for us as common mwananchi? So I think those are critical issues. I think the government should see how best to respond to, and also to put the right measures.
All right. Now, talking about health workers and their exposure, we have seen Pumwani Hospital being closed down after first 41 health workers, health staff tested positive for COVID-19. And today, in the last 24 hours, 12 medics have tested positive in Nyeri County, which now portends a crisis in terms of having the health workforce being infected with COVID-19. Therefore means that people who are on the front line to battle this particular pandemic are not there. Our system seems to be crashing in a sort of way should the infections continue among the medics. Does it mean the government is not doing enough? Because the question has been, they are not getting enough protective gear, which is quite a crisis, not only in Kenya, but across the world. There seems to be a shortage. So what do you think should be done to avoid cases of medics being infected with COVID-19 at this particular time?
Thanks, Irene, again for that question. I think we had alluded that the healthcare workforce is at the epicenter of this response. At the beginning of when this pandemic started, and when our first case was found or was diagnosed in Kenya on 13th March, if I'm not wrong. So since the healthcare workforce is at the epicenter, we advocated and we are champions for health rights for all, including the healthcare workers. So we were championing for ensuring that the healthcare workforce, first of all, have the right to equipment, the PPEs, for them to be able to take care of any influx of patients or any COVID-19 patients that will be coming to the health facilities, because they are the frontline responders. One of the other key challenge, and maybe this could also be attributed maybe to also the number of cases that we are currently getting from the healthcare facilities. Apart from the right and correct PPEs, we talked about training of the healthcare workforce in control, management, and response to COVID-19. Because from the quick assessment that we did is that almost 90% by that time had not been trained. So the question is, after that time, have they been trained? Do they understand? Do they know the protocols? Though the guidelines are there, we know MOH have done a good part in sharing the guidelines for both healthcare workforce, for both people with underlying conditions, for even home care-based support. But have the healthcare workforce been trained? Do they understand all this? Have they been trained? So it's about the issues of PPEs, it's about training, and also it was about the healthcare facilities itself. Have they been well equipped in order to handle for the influx of the patient? Because without proper ventilation, facility ventilation, and proper equipment, then it means they'll be constantly be exposed. And these were the things that we were talking about. And one of the key things that was coming out of our initial discussions with the healthcare workforce, they were more worried because they don't have any life cover, because you see they are the only ones who can be able to respond at this particular point in terms of providing medical services, yet which means they are exposing themselves because they are the frontline workers, but they were more also scared about their exposure, infection, and in case of any eventuality, if they succumb to because of exposure to COVID-19. So they were talking about the life insurance cover, they were talking about the life cover, the WIBA, the work benefit insurance. So these are kind of things that they came out clearly, and it seemed they have not been tackled to date, though they came out some time back. So I think that could be my quick, response to that particular question.
All right, now talking about life cover, I don't know, as you know, Kenyan organization, given that you are a non-governmental organization, of course, looking into the issue of health rights, have you received some sort of complaints from Pumwani health workers? They say that some of those who were infected with COVID-19 are now being asked by the government to contribute to get health services, yet we expect the government will cater for their medical bills, given that they were indeed helping the government to battle this particular pandemic. Have you received that particular complaint?
From an organization perspective, we are yet to receive, but we are aware of that, and we've been in talks with the union, the KMPDU union, and also the nurses union, and also the clinical officers union. So we are pursuing that together with them, because we know clearly it was stipulated that for any healthcare treatment, it has to be catered by the government. But now these are healthcare workforce who are in the front line. They're trying to fight this pandemic. Yet when they're exposed, now they are meant to pay to cater for their cost, which to me is very. It doesn't add up. The government needs to step in, and they need to support the people who are in the front line fighting this particular pandemic. And with the numbers, they'll keep on increasing, because currently it's a community transmission. So people are the transmission might keep on going if people also don't take care of the right precautions or the right measures. So the government needs also to take responsibility and support the healthcare workforce. And that's why we talked about occupational safety and health. This was one of their main concerns, because they knew by responding, they're exposing themselves. And also they were saying they don't have the right equipment. The equipment are not, because some of those, the PPEs that they were being supplied, they are single user equipment. So it means after that, after interaction with one patient, you have to dispose it. But they had to reuse it because they were not sufficient. So you can see this healthcare worker is actually exposing themselves by trying to save someone's life. And unfortunately, if they're exposed, now the government doesn't want to take care of that particular expenses. So I think that these are critical issues that we need to bring them on the table. We have a discussion through the CSOs network, bringing together the county government, the national government, the healthcare workers unions, so that we amicably be able to come up with a solid solution that we can take this forward.
A few weeks ago, we had the first case of a doctor who succumbed to COVID-19, Doreen Lugelike, may her soul rest in peace. It sort of created a shockwave among the medics who have been battling this particular virus, which raises the question whether the government really took the position to offer psychological support to doctors who are battling this particular pandemic, since they have the fear of them getting infected and also infecting their loved ones. Are we seeing this particular support being ensured that there's some sort of consistency in helping the medics who are battling this particular virus?
Thanks for that again, Irene. I think this is a lengthy and in-depth discussion that the government needs to take into consideration going forward. Mm-hmm. Because alluding to our previous discussion with the healthcare workforce, 82% of the healthcare workforce, when the pandemic was, sometimes in April or early May, they alluded that they require psychosocial support. And the reason why they require psychosocial support is because they were not prepared for this situation. And there is also stigmatization from the community. They also alluded to putting more hours working in order to take care or provide healthcare services to the patients. And also now for these untimely events when one of them succumbs to COVID-19. So these are major issues that they highlighted that contributes for them to require psychosocial support. So now based on that, and also looking at these are healthcare workforce, they have families, they have dependents, and on top of that, they are saying they don't have life insurance cover, they don't have the work injury benefits that they're supposed to have. Then where do you put this particular healthcare worker? Because they feel they already they are operating at a very disadvantaged mode. So I think there needs to be, as you've rightly put, there needs to be a lot of psychosocial support given to a healthcare workforce because they feel overburdened, they feel overstretched, and they are humans just like me and you who are working in different areas of expertise. So we need to support them fully. We need to give them the right devices. We need to give them all the support, including psychosocial support. So I think based on the recent healthcare workers who have succumbed, I think this one calls for more attention to our healthcare workforce to ensure the occupational safety and health is up to the right and the required standards, so that such issues, because occupational safety and health also incorporates issue of psychosocial support that they need to be provided because of the cases that they are working on. So I think it's upon the government as part of the services and the incentives that they're giving to the healthcare workforce. This should be at the core also in terms of their priority, and they should keep on discussing with the healthcare workers union to find out an amicable solution on what the healthcare workers need most, because the approach needs to be specific to the needs of the healthcare workforce.
All right. Now, as we finalize, of course, do you think as a government, even as the Ministry of Health, are we borrowing a leaf or two from the countries who have been able to battle this particular pandemic successfully? Do you think the path that we're taking as of now, given that the numbers have continued to rise, we are racing towards our peak? Do you think the government is doing enough to advocate for health rights, even as we battle this particular virus?
What I can say, the government is trying, but there's still a lot to be done, because this one calls upon about our healthcare system, like I mentioned earlier. Our healthcare system it shows that we are still, sorry for that. Okay. So in terms of what I can say is that the government is trying its best, but I think they can do better, and they have the capacity to do better. So it's upon them now to up their game in terms of their response, looking at and also borrowing from the countries that have managed this well, including countries. So what have they done best, or what have they done better in order to respond to this pandemic? It comes down to a system overhaul, a total complete system overhaul on how this pandemic is handled, starting from just the basic. I know we are doing contact tracing, but that real-time data is very important, and it needs to reflect in the healthcare system for them to be able to respond. Contact tracing requires that if a person, for example, has been confirmed positive and they want, they have been taken into, they have been quarantined, or they have been initiated on treatment, then what does that mean? It means that clearly this person had interaction with several people. So contact tracing needs to be done very quickly. Mostly what is recommended with the best practices, it should be done within the 72 hours so that you get all the contacts that were able to interact with this particular patient, so that they can also be traced, and quick measures can be done in terms of testing and so forth. So I think those are key things. And also looking at our healthcare system, do we have the enough capacity? Do we have enough bed capacity? We know the president instructed or directed all the counties to have at least a minimum of 300 bed capacity. First of all, do all the counties have this ICU beds capacity in their respective counties? That's a question mark we've not been able to answer. I've been following the media, and what has been covered, it's we are not yet there. Yet we've opened up the economy. So people are engaging, people are traveling. There's a lot of community transmission. So that one tells us something. Are we well prepared? And for those, those are other things. And we've talked about, you've clearly seen from the Healthcare Workers Union, they're saying they do not have enough healthcare workers to respond to the current numbers. They are saying in the next 2 weeks is going to be alarming, because the influx, the numbers are keeping on increasing, yet the capacity in terms of the healthcare workers is still constant. So what does it mean? Do we have now, what are the other measures that we can be able to take as the government, and also as other partners who are also supporting the government? Because our work is also to support the government, and also to hold them accountable to the measures, and also according to the key articles of the Constitution, that they have to do their mandate in order to provide healthcare services for all. So that's what I can say in terms of preparedness, and also borrowing from our respective countries. I gave an example earlier in regards to Uganda and Rwanda. They have done better. Can we borrow a leaf from them? How have they been able to do this? But some of the measures cannot be redone, because countries like Rwanda did the lockdown immediately. So that one cannot be redone. The virus is already with us now. So how do we manage it from here going forward? That should be the key question, and that should be how the government and the civil society and the Healthcare Workers Union should be foreseeing this journey.
That has been Mr. Alex Muthui from Kelin Organization, which is a non-governmental organization advocating for health rights, of course, looking into the plight of health workers. He says it is really a sad situation, that even if the government is doing enough, not much is being done. We can't have cases of the government now asking health workers who have been infected with COVID-19 in Pumwani to pay, to cater for the cost of their treatment. It is really a sad situation there. We are taking a short break, but we'll be back in a moment. Please don't go away.